Good afternoon, everyone. Thanks so much for joining the Office of the New York State Attorney General for today's press conference. We'll be starting momentarily. As a reminder, please make sure your name and press outlet are fully visible as your username. And during Q&A, if you have a question, please use the raise hand feature. We'll be taking on-topic questions. Thanks again for joining us, and we'll be starting momentarily. Good afternoon again, everyone. Thanks again for joining today's press conference. We will be starting in just a moment. At the Q&A at the end, please make sure your name and outlet are fully visible as your username. And again, if you have a question during that period, please use the raise hand feature, and we'll take on-topic questions during that period. Thanks again, and we'll start in very, very soon. Thank you.
Good afternoon, and thank you for being here. Today, I am announcing a lawsuit to stop the most sweeping and unlawful assault on public health in our nation's history. This administration has taken a wrecking ball to the Department of Health and Human Services. HHS is responsible for protecting and preserving public health. And since taking office, this administration has fired scientists, closed labs, shuttered life-saving programs, without rhyme, reason, or any legal authority. Nothing but devastating consequences for millions of Americans. This is not government reform. This is not efficiency. The federal government has cut lab capacity so much that they have all but stopped testing for measles in the middle of an unprecedented measles outbreak. They have nearly stopped testing for measles. And right now, New York's public health lab, the Wadsworth Center, one of the only labs in the country still equipped to detect rare infectious diseases, is scrambling to fill the void left by a hollowed out CDC. The World Trade Center Health Program, which provides medical care for over 137,000 9/11 responders and survivors, is on track to lose the doctors needed to certify new cancer diagnosis. 9/11 heroes will be denied care because this administration chose to fire their doctors. And at the same time, children in New York and across the country are at risk of losing access to Head Start, one of our most essential early childhood programs. With grant support frozen and regional offers shuttered, Head Start centers are facing delayed funding, staffing shortages, and a very real threat of closure. And that would mean children losing meals, losing classrooms, and losing critical care. It would mean foster families with no one to turn to for help. And it would mean working parents forced to choose between their jobs and their children. In just a few short weeks, this administration has unraveled decades of progress. In the midst of a mental health and addiction crisis, this administration fired half the staff at our nation's mental health and substance abuse agency, SAMHSA. The first and only SAMHSA regional director for New York was removed, leaving no one in his place. They revoked opioid response funding. They gutted the 988 suicide hotline support team. They slashed reproductive health offices, wiped out the disability services teams, and fired the entire team that runs the low-income home energy assistance program, and they eliminated testing for lead poisoning in children. They dismantled the agency that oversees Meals on Wheels, leaving local providers scrambling to keep seniors fed and safe, and eliminated the scientists responsible for tracking HIV, tobacco use, and fertility treatments. They even fired the experts who calculate the federal poverty guidelines, the numbers we use to determine who qualifies for Medicaid, SNAP, Head Start, and housing assistance. Without those numbers, millions could lose access to the help they need to survive. This is not how government is supposed to work. These actions are dangerous, cruel, and illegal. They defy Congress's authority, and they violate federal law. And that is why today I am leading a lawsuit joined by Democratic attorneys general across the country to stop this administration from tearing down our public health infrastructure. We are asking the court to halt the unlawful dismantling of HHS, to stop the mass firings, and to restore the life-saving programs that millions of Americans depend on, including 9/11 responders, children, and New Yorkers whose lives depend on HHS. And now, I'd like to invite Chanel Portia Albert to say a few words. Chanel is the founder and executive director of Ancient Song Doula Services. Chanel?
Thank you very much for hosting this press conference today. As mentioned, my name is Chanel Portia Albert, and I am the founder and executive director of Ancient Song. We are standing at a critical crossroads in our country, one where the lives of mothers and babies hangs in the balance. The ongoing stripping away of our maternal health infrastructure through the dismantling of crucial information on access to IVF and family planning, and the defunding of entire departments dedicated to maternal and reproductive health is not coincidental. It is a clear signal. Mothers and babies are not being prioritized. We live in one of the most industrialized nations in the world, yet we fare far worse than our global counterparts. This is not because we lack the ability to give birth, but because of the social conditions we are forced to contend with. In a nation as wealthy and resource-rich as the United States, we should not have people choosing between care and survival, between feeding their families or attending a postpartum visit. We are not failing due to our lack of innovation or our knowledge, and we are failing because we lack the political will to protect the people who bring life into this world. This crisis will only grow deeper, with long-term consequences for generations to come, unless we act now. That means investing in maternal health programs, funding community-centered care, strengthening data collection, and creating bipartisan policies that center equity, health, and dignity, not political agendas. So let me be clear. The dismantling and the erasure of maternal health infrastructure reveal a devastating truth, that mothers and babies are not a priority in this nation. In one of the wealthiest, most industrialized countries, we rank lowest or the worst for maternal health outcomes. If we do not invest now in data, programs, and the policies rooted in equity and upliftment, we will bear the generational costs of this neglect. Maternal health must be a bipartisan priority because the future of our communities depends on it. Thank you.
Thank you, Chanel. Next, we will hear from Gary Smiley. Gary was an FDNY hazmat paramedic and one of the first responders to the World Trade Center on 9/11. He now serves on the World Trade Center Medial Advisory Steering Committee, and he is a tireless advocate for his fellow heroes. Gary?
Good afternoon, Madam Attorney General. Thank you for having me. Since February, the cuts that are going on to the World Trade Center Health Program, a program that is probably the only governmental program that runs completely efficient with no waste, no fraud, and cares for 141,000 responders and survivors, is being gutted by the administration. They promised that they would not touch the program. They lied. They fired Dr. Howard, who is the director of the program, and then they said, oh, it's a mistake. They rehired him, and then we found out he wasn't rehired, he was fired. In the last few weeks, we have found that new people coming into the program with cancer have not been able to be certified for their cancer. When one of the clinics sends in a certification, Dr. John Howard or the other physicians that work with him sign off on the certifications. In the last couple of weeks, we know of at least 3 members of the FDNY, and there are probably dozens of others that were denied entry into the program. They said on Friday that that was fixed, but we don't know, and we don't know for how long. They say that new certifications are restarting again, but we don't know. They say Dr. Howard has been restored to full position, but that is not true. What we do know is true is that these men and women who survived one of the most horrific attacks on this country are now worried that their insurance is going to go away, that their life-saving care for cancer or other respiratory illnesses or psychiatric care is going to go away. It's causing irreparable damage. It has already caused irreparable damage. I receive phone calls every day from these men and women saying, Gary, am I going to be able to afford the care on my own because this program is going away? This country promised 22.5 years ago to never forget, and they have not forgotten up until now. This administration, Elon Musk, and everybody that's been involved has lied to the 9/11 community and has done damage that is just irreparable. Most of the survivors and responders have post-traumatic stress disorder. The fear alone that your care will be denied, that you won't be able to go to your therapist, is going to lead to self-harm and is going to lead to people taking their own lives because they're going to be afraid. And that includes new illnesses. As the Attorney General mentioned, they have cut the entire research staff. There is no more money for research grants. There is no money to investigate the 19 conditions that we wanted added, including the specialty conditions. So if you are a responder or a survivor that was banking on, hopefully NIOSH and the CDC will start to cover these illnesses, you have no hope anymore. And that is not fair to these folks. We all went down there. Those that responded as we did because we worked. Whether you were an iron worker or a firefighter or a police officer or a paramedic, or if you lived or worked in the area. And now that program that's supposed to take care of you was ripped apart without any basis of doing so. And it is just reprehensible. And I join you in thanking you for adding this lawsuit and hopefully restoring this program that is truly saving lives. Thank you.
Thank you, Gary. Now I'd like to welcome Paula Inargüe from United Neighborhood Houses to discuss the threats Head Start programs are currently facing. Paula?
Good morning, everyone, and thank you for the opportunity to speak on this important issue. My name is Paula, and I'm a policy analyst at United Neighborhood Houses. United Neighborhood Houses is a policy and social change organization representing neighborhood settlement houses that serve New Yorkers from all walks of life. For nearly 6 decades, Head Start has provided comprehensive early learning, health, and family support services to over millions of children and families nationwide. In New York alone, Head Start and Early Head Start programs serve over 43,000 children across over 200 programs, including 15 settlement houses within our network, and employ more than 14,000 people. Just a few weeks ago, the federal government abruptly shut down 5 regional Head Start offices, including the one that supports New York, leaving providers in the dark, unable to reach federal contracts, and unsure how to reassure the thousands of families who count on Head Start every single day. Applications are stalled, questions about funding for Head Start keep rising, and the fear of what comes next is growing among providers and families. The shrinking of the Department of Health and Human Services is clearly having devastating impacts on our neighborhoods and families. Undermining childcare does not help working parents, it hurts them. That's why we're here standing firmly with you, Attorney General James, as you fight to protect these programs and the families they serve. Every child deserves stability, care, and the chance to thrive. Thank you.
Thank you. And now, last but certainly not least, we'll hear from Charles King, and founder and CEO of Housing Works and longtime HIV/AIDS activist. Charles?
Thank you, Attorney General James, and I want to thank you and the other attorneys general for bringing this litigation to restore and preserve health and human services. I'd like in my remarks to underscore 4 key elements that your lawsuit addresses. And the first is the elimination of HIV services and prevention out of the Centers for Disease Control. From the inception of the epidemic, the Centers for Disease Control has been critical in helping the community design effective interventions to prevent the transmission of HIV. And right now, it is the principal source in most states across the country of access to pre-exposure prophylaxis to prevent people who are at risk of HIV from contracting the disease. The role of the CDC is even more important now because up until now, we've only had a daily pill to prevent HIV, and we now have new, longer-lasting pre-exposure prevention devices and need them approved and implemented across the United States. And this gutting of the CDC is going to prevent that from taking place. There's also the transformation that is happening at HRSA, which has guided our HIV treatment efforts around the country. Here in New York, we have finally brought the epidemic down to a rate that we have more people dying of all-cause mortality than we have new infections from HIV. And with what is happening with regard to HRSA, as well as what is happening with regard to CDC, we run the risk of seeing this reversed. As you know, Housing Works serves the most vulnerable and marginalized New Yorkers, including people who are presently homeless or who have experienced homelessness, who are living with HIV, other chronic conditions, and substance use disorder. So this brings me to the third issue that I want to address, and that is the dismantlement of SAMHSA. SAMHSA has provided a significant part of our funding to address substance use disorder, as well as addressing mental illness. Most particularly, SAMHSA only a few years ago started recognizing harm reduction as a critical intervention to work with people who have substance use disorder, even while they're still using drugs. And this has now basically completely disappeared. The last item I would want to address is what has taken place with regard to research that is taking place under HHS auspices. We've now seen research being canceled having anything to do with LGBTQ health. And that includes things like treatment of the combination of sexually transmitted infections as well as HIV. It also includes research into treating TB, and in particular treating multi-drug resistant tuberculosis. All of these things lead to the very scary prospect of revived epidemic of HIV here in New York and across the country, as well as the potential risk of a new epidemic of tuberculosis. So we need a strong Health and Human Services. We need these departments under Health and Human Services to guide the community efforts that are addressing HIV and other transmissible diseases. And so for that, we're incredibly grateful for your intervention, Attorney General James.
Thank you. And we will now take on-topic questions.
Thanks so much, Attorney General. Reminder, if you have a question, please use the raise hand feature. Give us just a moment. Thanks so much. Thanks so much, everybody. Aria Bendix from NBC, go ahead.
Thank you for taking my call. Attorney General James, I'm just curious if you feel like your office has an accurate understanding of all of the funding cuts and staffing cuts that have been issued to date, and who is responsible for those, and if there's a difficulty tracking them, how you're sort of going about getting your information.
So we are still getting declarations from the governor's office, and we also have a hotline where individuals also are filing complaints here in the New York State office. But we are also hearing from all of the other states, from Arizona, from Colorado, from California, from Connecticut, from Delaware, from Illinois, from Maine, from Michigan, from Maryland, Minnesota, New Jersey, New Mexico, Oregon, Rhode Island, Vermont, Washington, Wisconsin, and the District of Columbia. We believe we have a good handle on the elimination and or reduction in programs and in services, and also as it relates to reduction in force, RIFs. We are not filing at this point in time a preliminary injunction. We will file that later on in the week, but we are continuing to accumulate and gather information on the ground with respect to the complete destruction of HHS and all of its programs.
Thank you so much, Attorney General, and thank you so much for the question. Not seeing any others at the moment, we will end today's press conference. Thank you again to our esteemed guests for joining us this afternoon. Have a great afternoon. Happy Monday. Thanks, everyone.
Thank you.
Thank you very
Thank you
much.
so much. Thank you.